very much for attending the symposium today. I just want to say a couple announcements, some housekeeping announcements, and then a couple announcements before I start and present the first speaker. My name is Bernardino de la Torre, and I'm the Youth and Young Adult Substance Use Disorder Program Policy Coordinator for Oregon Health Authority in the Child Family Behavioral Health Unit. And just want to let you know that bathrooms are down through the lobby, down the hallway. If you want, to take a break, that's where they are. The other thing is we'll be having some lunch shift that'll happen around 10:30, but the coffee and the water will remain for people to access whenever they want. The other thing is we have a room over here. I think it's called the Maple Room, the first one with the round tables. If you need to make a phone call or do something business-wise, feel free to use that. For the presenters and the panelists, we have this other room here with the square tables that you can access for preparing yourself for the presentation or anything you need to discuss in those rooms, and those are accessible to you. I just want to say I'm actually feeling really grateful to have the opportunity to be here at U of O, where I started when I first moved to Oregon, and was very welcomed, and finished my degree here, my 3 last classes for my degree in California, and also very proud that my daughter also graduated here from U of O this last June, and is starting a master's degree at the end of this month here at U of O, so feel very proud about that. And I also want to thank the volunteers from 4D. Without you, it wouldn't be possible helping with the registration. And also want to thank Jen Davis, the executive assistant from Hedco Institute College of Education, who's also been very instrumental in making this happen, along with Emily Tanner-Smith, Dr. Emily Tanner-Smith, and Dr. Lev from the College of Education. Thank you for being so welcoming when I approached you to help me to organize this event. I also want to thank the presenters for agreeing to, they right away said, yes, we'll help you out. So I didn't do a lot of work in trying to convince people, and not one said no. So I'm really glad we have a very good lineup of presenters for today that you'll see on the agenda. I also want to say that this actually came out of, many of you are here who were part of the collaborative that I put together for community engagement. Wednesday next week will be my 2-year marker being in this position. And I started right away with, thank you, started right away with doing community engagement through a collaborative, and we had a lot of attendance. The input from the community was that they wanted to have more workforce development for mentor peer recovery and for prevention specialists and addiction specialists. And so that's why the focus of this symposium, this is a result of the input from the community engagement. And so people will be receiving 7 CEUs for their certification for those that are trying to obtain certification for peer mentor recovery or addictions or prevention specialist. And at the end of the day, there will be a slide with a QR code that you can scan and fill out the form. And then once you fill out that form with the feedback of this symposium, you will receive a certificate through your email. If you didn't get a certificate after you fill out the form, make sure that you let me know or email me, and I'll make sure that we'll include that email so that you can receive that certificate. With that said, I would just like to say that it's really important what's happening here in Oregon right now with the need of prevention and for recovery services. When I came to U of O, I came with the idea of prevention, and throughout the past 20 plus years, I've stuck to that model. I have a lot of evidence of projects that show what I've done throughout the past 20 years with youth, both gang involved and substance use involved, both within communities and within schools in 3 counties here in Lane County, Multnomah County, and Washington County, and now feel very grateful to have this position with the Oregon Health Authority and doing this prevention force that we need to have in Oregon that has been lacking for the past 20 years. It was defunded, and now it's presently moving in that direction. So I'm really happy that this is happening, and so thank you very much for being here today. I'd like to start with a few comments here to present our first speaker, Ms. Ebony Clark, Behavioral Health Director of Oregon Health Authority, and previously the Director of Multnomah County Health Department, is a licensed clinical social worker who has 25 years of experience working in both the publicly funded and nonprofit behavioral health arena, influencing policies centering the work in an equity and consumer lens, developing services and supports, providing leadership, organizational development, people management, and equity and inclusion. Ebony will join the OHA at the end of February after working for Multnomah County since 2010, where she functioned as a behavioral health director and in several other leadership positions. Before joining the county, Ebony worked as a service director of Child and Family Services at LifeWorks Northwest. In that role, she oversaw child and family outpatient and mental health prevention and culturally specific adult mental health and addiction services. Ebony earned her Bachelor's of Arts degree from the University of Oregon in Community and Human Services in 1999 and her master's degree in social work from Portland State University in 2001. In October 2020, Ebony was appointed by Governor Kate Brown to the Oregon Health Policy Board, and in 2013, Oregon Governor John Kitzhaber appointed Ms. Clark to the Oregon State Board of Licensed Social Workers, where she served 2 terms, and she has also volunteered her time on the Lake Oswego School District Board appointed Diversity, Equity, Inclusion Committee as one of the co-chairs. Ebony's mission is to build and support a continuum of care that yields equitable and quality services to promote individual, family, and community healing and well-being. During her time off, she enjoys spending time with her husband of 20 years, Matt, and her 2 sons, Mateo and Miles, ages 16 and 11. Let's please welcome Ms. Ebony Clark.